subsequent transplantation, but this is not an eligible option for all patients, and therefore several groups try to in vitro mature ovarian tissue in order to activate primordial follicles. The ultimate goal is to obtain mature and competent oocytes in an in vitro setting, starting from primordial follicles, and therefore we need to develop and optimize an in vitro culture system. In this work, we included 6 patients, 3 oncologic patients and 3 transgender patients. The oncologic patients comprised fertility preservation for an acute lymphoblastic lymphoma, myeloid lymphoma, and breast cancer, and none of the patients received chemoradiotherapy prior to the oophorectomy. The transgender patients, matched for age with the oncologic patients, did receive intramuscular testosterone during more than a year, every 12 weeks. The study design is a tissue culture during 6 days, where we included 24 tissue fragments per patient, so in total 144 cortex fragments. We cultured them for 6 days, and we fixed 6 fragments per day per patient every second day for subsequent analysis, being an H&E staining for follicle classification, a laser capture microdissection for collection of follicles of interest for downstream RT-qPCR, and fluorescent staining for different proteins of interest. If you look at the tissue preparation, first of all, the tissue was pulled mechanically, the fragment was halved and comb-like incised, and finally incised but not fragmented for an adequate Hippo pathway disruption. Downstream analysis was, as mentioned before, laser capture microdissection of follicles who were collected per follicle type per day per patient. First the follicle, then separately the stromal cells surrounding the follicle of interest. And we also conducted fluorescent staining, where parallel staining of both the phosphorylated and the unphosphorylated protein was performed on the same section, enabling a parallel analysis. All targets of interest were part of the Hippo or the PI3K ACT pathway. In the Hippo pathway, we focused on MST1-2, the key protein, yes-associated protein, both phosphorylated and unphosphorylated, and then the downstream transcription of one growth factor being CTGF. In the PI3K ACT pathway, we focused on PI3K, ACT, and FOXO as proteins of interest. Looking at the results, first of all, we look at the follicle distribution, where on day 0 in both groups, the primordial follicles were predominantly present, and these primordial follicles significantly decreased over culture, with a significant difference between day 0 and day 4 in the transgender patients, and between day 0 and day 2 already in the oncologic patients. The intermediate group had a trend to increase, where the primary follicles increased significantly on day 4 in the oncologic groups, and the secondary follicles were significantly increased in the transgender group on day 6, however small in total numbers. Looking at the pathways of interest, first of all, MST1 and 2 had a significantly decreased expression, most commonly in the transgender patients when comparing day 0 and day 6, whereas the localization was also dynamic, being heterogeneously in the cytoplasm in primordial, intermediate, and primary follicles, going to a more nuclear localization in the antral follicles. The key protein, the yes-associated protein, was predominantly present in the inactive, the phosphorylated form on day 0 in all follicle types, where follicle disruption, so Hippo pathway disruption, caused a disappearance of PYAP comparing day 0 to day 2, and an appearance of the active form, the YAP, already on day 2 in the transgender patients, where disappearance of the active form appeared only on day 4 and 6 in the oncology group. Downstream transcription of CTGF showed an increased expression comparing day 0 to day 2 in both groups. Looking at the other pathway of interest, we saw rather stable expressions of PI3K, being a cytoplasmic localization in all follicles on all culture days, where the P-ACT staining, so the active form, had a trend to disappear comparing day 2 to day 0, but then remained stable, and the P-FOXO staining was different between both groups, more present in the transgender patient group, but absent in the oncologic patients. This enables us to conclude a few things. First of all, our results highlight a Hippo pathway-driven primordial follicle activation in vitro, and this predominantly from day 0 to day 4. Secondly, the slightly different findings between oncologic and transgender patients support an adapted tissue preparation for Hippo pathway disruption, and based on this Hippo pathway-driven primordial follicle activation in the first part of the culture, we also recommend a shorter phase of this tissue culture part. In a broader context, we might recommend to transplant larger strips, as this causes less follicle burnout due to Hippo pathway disruption, and this could be of benefit. Thank you for your attention, and I'm happy to answer your questions.